Anabolic steroids and performance-enhancing substances. Performance-enhancing drugs. Know the risks. Are you hoping to gain a competitive edge by taking muscle-building supplements or other performance-enhancing drugs? Learn how these drugs work and how they can affect your health. Most serious athletes will tell you that the competitive drive to win can be fierce. In such an environment, the use of performance-enhancing drugs has become increasingly common. Using performance-enhancing drugs, aka doping, isn't without risks. Take the time to learn about the potential benefits, the health risks, and the many unknowns regarding so-called performance-enhancing drugs. You may decide that the benefits aren't worth the risk. Anabolic steroids. What are they? Some athletes take a form of steroids known as anabolic androgen steroids, or just simply anabolic steroids, to increase their muscle mass and strength. The main anabolic steroid hormone produced by your body is testosterone, which has two main effects on your body. Anabolic effects promote muscle building, and androgenic effects are responsible for male traits such as facial hair and a deeper voice. Why are these drugs so appealing to athletes? Besides making muscles bigger, anabolic steroids may help athletes recover from a hard workout more quickly by reducing the muscle damage that occurs during the session. In addition, some athletes may like the aggressive feeling they get when taking the drugs. Anabolic steroid includes any drug or hormonal substance chemically or pharmacologically related to testosterone. Performance-enhancing substance means a manufactured product for oral ingestion, intranasal application, or inhalation containing compounds that contain a stimulant, amino acid, hormone precursor, herb, or the botanical or any other substance other than an essential vitamin or mineral. Also, they are intended to increase athletic performance, promote muscle growth, induce weight loss, or increase an individual's endurance or capacity for exercise. The Dietary Supplement and Health Education Act of 1994 limits the Food and Drug Administration from regulating products. 18.6% of U.S. supplements contain anabolic steroids. Many products may be contaminated with lead, pesticides, arsenic, and mercury. Strength of the products available can vary. Effectiveness studies have not been performed among high school age athletes. Here are different variations of steroids and performance-enhancing substances. Why do students take anabolic steroids or performance-enhancing substances? To boost athletic performance, build muscle, increase body mass, or lose body fat. What influences a student to take anabolic steroids or performance-enhancing substances? Some influences can include role models, media influences, peer pressure, and body image. Dangers of anabolic steroids and performance-enhancing substances. Steroids are dangerous for two main reasons. They are illegal. They can damage a person's mental and physical health, and if used by adolescents can have permanent negative consequences. Many athletes take anabolic steroids at doses that are much higher than those prescribed for medical reasons. It is impossible for researchers to design studies that would accurately test the effects of large doses of steroids on athletes, because giving participants such high doses would be unethical. This means that the effects of taking anabolic steroids at very high doses haven't been well studied. Anabolic steroids come with serious physical side effects. Some risks for both males and females include acne, stomach growth in teens, high blood pressure, unhealthy cholesterol changes and heart disease, blood clots and stroke, liver damage, jaundice, or liver cancer, headaches, aching joints and muscle cramps, increased risk of ligament and tendon injuries, needle sharing results in higher risk for serious infections like hepatitis B and C or HIV, and baldness. Gender differences and risks of drug use for young females include self-esteem, depression, body image, and media. For young males, it can include risky behavior, impulsivity, body image, and media. Health risks for males include shrinking of the testicles, low sperm count, impotence, increased breast growth in males, and enlarged prostate. Health risks for females include breast shrinkage, male-type facial and body hair growth, deepening of the voice, problems with menstrual periods, enlarged clitoris. Psychological health risks. Roid rage, defined as severe aggressive behavior that may result in violence such as fighting or destroying property. Severe mood swings, paranoia, anxiety and panic attacks, or depression and thoughts of suicide. Definition of cycling. Anabolic steroids are taken orally or injected, typically in cycles of weeks or months, rather than continuously. Cycling involves taking multiple doses of steroids over a specific time, stopping for a period, and starting again. Definition of stacking. Users often combine several different types of steroids to maximize their effectiveness while trying to minimize negative effects. You may have heard anabolic steroids or performance-enhancing substances called roids, juice, hype, pumpers, gym candy, Arnold's, gear, weight trainers, stackers, 420. Androstenedione is a hormone produced by the adrenal glands, ovaries, and testes. It is a hormone that normally converts to testosterone and estradiol in both men and women. Andro is available in prescription and non-prescription forms. The prescription version is a controlled substance. Andro is also sold without a prescription as a nutritional supplement. Manufacturers and bodybuilding magazines tout its ability to allow athletes to train harder and recover more quickly. However, its use as a performance-enhancing drug is illegal in the United States. Scientific studies that refute these claims show that supplemental andro doesn't increase testosterone and that your muscles don't get stronger with andro use. In fact, almost all of the andro is rapidly converted to estrogen, the primary hormone in females. Side effects of andro in men include acne, diminished sperm production, shrinking of the testicles, enlargement of the breast, and in women can include acne, masculinization such as deepening of the voice, and male pattern baldness. In both men and women, andro can decrease HDL cholesterol, which is the good cholesterol, and puts you at greater risk of heart disease and stroke. The human growth hormone is a hormone that has an anabolic effect. Athletes take it to improve muscle mass and performance. However, it hasn't been shown conclusively to improve either strength or endurance. It is available only by prescription and is administered by injection. Adverse effects related to human growth hormone range in severity and may include joint pain, muscle weakness, fluid retention, carpal tunnel syndrome, impaired glucose regulation, cardiomyopathy, and hyperlipidemia. Erythropoietin is a type of hormone used to treat anemia in people with severe kidney disease. It increases production of red blood cells and hemoglobin, resulting in improved movement of oxygen to the muscles. A synthetic form of erythropoietin is commonly used by endurance athletes. Erythropoietin use among competitive cyclists was common in the 1990s and allegedly contributed to at least 18 deaths. Inappropriate use of erythropoietin may increase the risk of thrombotic events such as stroke, heart attack, and pulmonary edema. Diuretics are drugs that can change your body's natural balance of fluids and salts and can lead to dehydration. The loss of water can decrease an athlete's weight, helping him or her to compete in a lighter weight class, which many athletes prefer. Diuretics may also help athletes pass drug tests by diluting their urine and are sometimes referred to as a masking agent. Diuretics taken at any dose, even medically recommended doses, predispose athletes to certain adverse effects such as dehydration, muscle cramps, exhaustion, dizziness, potassium deficiency, heart arrhythmias, drop in blood pressure, heat stroke, or even death. Creatine. Many athletes take nutritional supplements instead of or in addition to performance-enhancing drugs. Supplements are available over the counter as powder or pills. The most popular supplement among athletes is probably creatine monohydrate. Creatine is a naturally occurring compound produced by your body that helps your muscles release energy. Scientific research indicates that creatine may have some athletic benefit by producing small gains in short-term bursts of power. There is no evidence, however, that creatine enhances performance in aerobic or endurance sports. Your liver produces about 2 grams of creatine each day. You also get creatine from meat in your diet. Because your kidneys remove excess creatine, the value of supplements to someone who already has adequate muscle creatine content is questionable. Supplements are considered food and not drugs by the FDA. This means supplement manufacturers are not required to conform to same standards as the drugs do. In some cases, supplements have been found to be contaminated, which may inadvertently lead to a positive test for performance-enhancing drugs. Possible side effects of creatine that can decrease athletic performance include stomach cramps, muscle cramps, nausea, diarrhea, or weight gain. Weight gain is sought after by athletes who want to increase their size, but with prolonged creatine use, weight gain is more likely the result of water retention than an increase in muscle mass. High-dose creatine use may potentially damage your kidneys and liver. Stimulants. Some athletes use stimulants to stimulate the central nervous system and increase heart rate and blood pressure. Stimulants can improve endurance, reduce fatigue, suppress appetite, increase alertness and aggressiveness. Common stimulants include caffeine and amphetamines. Cold remedies often contain the stimulants ephedrine or pseudoephedrine hydrochloride. The street drugs cocaine and methamphetamine also are stimulants. Although stimulants can boost physical performance and promote aggressiveness on the field, they have side effects that can impair athletic performance. Nervousness and irritability make it hard to concentrate. Insomnia can prevent an athlete from getting much needed sleep. Dehydration and heat stroke. Other side effects include heart palpitations, heart rhythm abnormalities, weight loss, tremors, mild hypertension, hallucinations, convulsions, stroke, heart attack, and other circulatory problems. Do performance-enhancing drugs boost performance? Some athletes may appear to achieve physical gains from such drugs, but at what cost? The long-term effects of performance-enhancing drugs have not been rigorously studied, and short-term benefits are tempered by many risks. Not to mention that doping is prohibited by most sports organizations. No matter how you look at it, using performance-enhancing drugs is risky business. Common myths regarding steroids are safe. Taking any kind of steroid will result in death. Injectable steroids are safer than oral steroids. Steroids won't really stunt your growth. All steroids are pretty much the same. Steroid abuse isn't really a big problem in the US. All steroids are pills. Only a certain kind of person uses steroids. Steroids are not addictive. Steroids aren't as illegal as other drugs. Steroids build muscle without working out. Women don't use steroids, or roid rage isn't real.